Hello everyone, I am Eric, and the article we analyzed is titled Urogenital Tuberculosis, a narrative review, a recommendation for diagnostic and treatment, published in the International Brazilian Journal of Urology in 2025. This paper reviews the main clinical and therapeutic aspects of urogenital tuberculosis and extrapulmonary from that can affect the kidneys, ureters, bladder, and genital organs. Regarding the clinical manifestation, the most frequently symptoms include the persistent hematuria, increased urinary frequency, and lower back pain, often associated with radiological evidence of renal damage. For diagnosis, the gold standard remains the urine culture for Mycobacterium tuberculosis, but otherwise the most widely used test is the Gen Expert, which detects both the bacillus and rifampicin resist much faster. The pharmacologic treatment involves a 6 months regimen with rifampicin, isoniazid, pyrimidine, and ethambutol, while severe structural damage may require reconstructive or bladder augmentation surgery. Thank you.
Hello, my name is Bruno Diaz. The paper by Retral 2022, it says that urine smear and culture have low sensitivity, only about 10 to 15%, and the culture tests can take 6 to 8 weeks to show results. Molecular tests like NAG or gene smear are faster and more accurate, giving results in a few hours. They are not available in many hospitals. The tuberculin skin test and IGRA only show that the person was in contact with tuberculosis, not that this disease is active. The base article used all this information to make a standard way of diagnosis the disease. It says that molecular tests and urine culture are used for a definitive diagnosis, and the mounted and IGRA are used for a probable diagnosis. It also recommends gene smear as the first test to use because it is faster.
I will compare the results of two recent studies on urogenital tuberculosis. Both agree that diagnosis remains a major challenge. The tests we use, like culture and gene expert, are highly specific, but still miss many true cases. Interestingly, the meta-analysis showed that even lower sensitivity for gene expert, around 14% compared to about 60% in the narrative review. This gap shows that in real clinical practice, molecular methods alone aren't enough. That's why both studies emphasize a multimodal approach, combining PCR, histology, and clinical findings to reach a faster and more accurate diagnosis.
Hello, my name is Nazaret, and I'm going to talk about the treatment of urogenital tuberculosis that is named in the article Clinical Characteristics and Result of Genitourinary Tuberculosis in Sri Lanka, an observational study. Both the base article and this article, whose author is Jarahaya, agree the basic medical treatment is the same as for pulmonary tuberculosis: 2 months with 4 drugs, isoniazid, rifampicin, pyrocinamide, and ethambutol, followed by 2 months with isoniazid and rifampicin. The difference is in the approach. The base article recommends starting treatment even if no bacteriological confirmation, while Jarahaya suggests confirming it before starting to avoid unnecessary adverse effects. In summary, both agree that success depends on timely diagnosis, complete treatment, and good medical follow-up.
Hi, my name is Mael. While anti-tubercular therapy is a foundation for genital tuberculosis, it often fails to correct the severe irreversible structural damage left behind, such as extensive fibrosis and stenosis. Surgical management is primarily divided into ablative and reconstructive procedures. The main ablative surgery is nephrectomy, the complete removal of a kidney. This is performed when the organ is not functioning, several damaged, or calcified, essentially eliminating a focus of chronic infection and preventing future complications. On the other hand, reconstructive surgery aims to restore function, highlighted by procedures like elastoplasties to increase severely contracted bladder capacity. Ultimately, the successful long-term outcomes relies on combined therapy. ATT plus surgery is the key to achieving the restoration of optimal genitourinary function.